Hey everybody, this is Dr. Dan, and today I wanted to talk to you about testosterone replacement therapy and male fertility. Now, we do work with clients through Denver, Colorado, Westminster, Golden, Lakewood, and then if you're in this area, of course, we would love to help you out, but this goes for anybody anywhere. Any man or couple who've been struggling with fertility or low libido, low sex drive, those are huge red flags. And we got to talk about this from the male perspective. And sometimes men do need to be on testosterone replacement therapy, or at least some things that can bump up their testosterone. So I want to get into the intricacies of that, because sometimes we got to separate out, when a man needs testosterone itself, like bioidentical hormone replacement, or they need to improve their testosterone levels when it comes to fertility, because those are actually two separate cases. And I think it's important to understand how people end up coming here, because we have men and women that'll come to us and they've been having trouble conceiving. And so they usually go down the typical route of looking at all the female intricacies that have to do with infertility. And a lot of times there's not enough emphasis put on looking at the intricacies of male infertility and all the contributing factors that can get in the way of a male having really healthy semen, really healthy libido and sex drive, and then actually being able to, with their partner, conceive a healthy baby. So that's one story. It's a separate story. The other side of this is men who are having really low suboptimal testosterone levels, and it's affecting them. And the one thing that these both cases can share are the symptoms of low testosterone, which are going to be, brain fog, trouble putting on lean muscle mass. You don't have the drive that you once had. You will notice that maybe there's some problems with erectile dysfunction. A lot of times men will still have interest, but they don't have the performance that they once had, or they can't, continue with it. They have endurance issues when it comes to both exercise and when it comes to intimacy and sexual activity. So let's break these down. So first, let's talk about on the fertility side. So what'll happen is when the brain stimulates the testicles to make testosterone and semen production, that is a very particular coordinated effort of the pituitary gland. It stimulates your gonadotropin releasing hormone and gonads, and that's going to release, and this happens in women as well, it releases luteinizing hormone and follicle stimulating hormone, and you need both, and they target different cells in the testicles. There's cells in the testicles that produce testosterone and cells in the testicles that produce semen. And the luteinizing hormone will particularly, it has a receptor on these cells called Leydig cells. This is going to trigger your testosterone production, which then also creates a stimulus for more semen production along with your follicle stimulating hormone. And those have a target called Sertoli cells. Now, why am I telling you that? That may be, you may think that's a little too much science. The thing is, it's multiple hormone cascade that can get disrupted. Things like stress, inflammation, blood sugar, all of these things, even disruptions in sleep pattern, sleep apnea, narcolepsy, all of these different things can contribute to that stimulatory pathway that gives you both testosterone and semen production. And you want to identify what is actually causing the problem so that you can have a really effective solution. And that's something that I say all the time. You can't apply an effective solution if you don't know or truly understand what the problem is. So getting the right testing is really important. A lot of times, men will get a semen analysis, and of course you can identify those things as well, and I highly recommend it, because if you are trying to conceive, you want as healthy semen as possible, and you don't want to just temporarily improve that. You want to change the DNA, because the genetics in that semen is going to be half of the DNA that's going to make your child. So it's really, really important that you get that dialed in. And there's natural interventions that you can use depending on what's wrong with either morphology, the shape and the size of the semen, the motility, the total count, and the health of the DNA. So there's some really key things there. So if your goal is to conceive, you really, really want to make sure you understand those pathways, because if you take testosterone, your testosterone is going to get to a higher than normal level, and you're going to shut down those hormones in the brain that tell you to make testosterone and semen. So that can actually get in the way. So you do not necessarily want to go down the path of testosterone replacement therapy if you're having fertility issues, because it can shut down your semen quality. And that's a huge problem. Males will actually get a little bit of testicular atrophy, which means their testicles shrink, because you're no longer dependent on those cells in the testicles to produce testosterone and semen. Well, your semen is just a side effect. You lose the semen production just because. Now, you can offset that with a few things, but you absolutely will get a drop in overall count if you're taking testosterone replacement therapy. So you want to identify all these different pathways. You want to look at the hormones coming from the brain. You want to know how the health of the brain is. You also need to be looking at, like I said, you want to know blood sugar. You want to know inflammation. You want to know your nutritional deficiencies. You want to look at your thyroid. You want to look at the overall picture to understand how do you optimize that. Now, let's say you're not worried about having children in the future, or in the immediate future, the immediate time. Let's say you want to just optimize. Maybe you and your partner are beyond that and you're not wanting to have children, or children is just not something you're interested in. So then we can look at actual testosterone replacement therapy, because I'll tell you, with all the things that are out there as far as peptide therapies and growth hormone and all these interventions that you can do, testosterone is powerful. It is so incredible. It can make you feel good. It can improve your patience. A lot of people assume that testosterone is going to make you aggro, make you aggressive, but that's not the case. It actually, men need testosterone for their brain. You may be asking, why would we not consider the natural path all the time? Well, you should. You should always look at all the natural pathways that drive testosterone, because those things don't just interfere with your testosterone. Those are going to interfere with all these other natural functions in your body. So if you have any of those issues that get in the way, any of the roadblocks, right? One of the ways you can remember the roadblocks is just think of the 5 I's. You want to say insulin, inflammation, iron, infection, and intolerance to stress, or not having your nutrient insufficiencies, right? So you want to know all of those. So I might have named 6 I's there, but you want to make sure that you're hitting those pathways. So, but here's the thing. The reason, and there is clinical research on this, has shown decade after decade after decade, we're seeing a decline in overall testosterone in different generations. If you think about, I make a joke about it, but you remember, my grandfather had hairy knuckles, right? And, was deep voice and very thick, really thick hands. And, we're not seeing that anymore. We are truly seeing a decline. And there's a lot of research around this. There's a great book called The Countdown. And they actually did it here in the Front Range. And they identify that the microplastics that are in the environment are lowering overall testosterone. And they're very disruptive to hormones in general. Typically, we see the BPA really affects females, but the phthalates, the softeners in plastics, is causing an issue with luteinizing hormone, which is the trigger of those Leydig cells and dropping overall testosterone. And so what we're seeing is generation after generation, the upper limits of normal testosterone levels are dropping. So in order to feel truly optimal, some of us are really going to have to supplement, because the more years you have, on this planet, the more exposure you've had to those things. And so this accumulation of damage or disruption from these, what we call endocrine disruptors or hormone disruptors, have had more chance to create more issues for you. So To get to really optimal levels, we typically find that testosterone replacement therapy is really great. So again, if you're in the Denver area, this could be really beneficial for you. You know, anywhere around Denver, we work with men and women for hormone replacement. But if you're looking at infertility, we want to find all these pathways so we can optimize those without creating a decrease in total semen production. And if we're looking at just, you know, optimizing that testosterone and getting your, you know, lean muscle mass, improving your brain health and your longevity and the cardiovascular protection that comes along with that, you know, we love to talk to you. You can reach out to us. You can find us at peakvitalitydenver.com. We'll have links below with the video so you can actually get some help, get some answers. We'd love to help you out. And also, if you're in Arizona, you can look us up at Tucson Wellness MD, and especially in the Tucson area. We'd love to work with you as well there. So we're in multiple areas. There's a couple different clinics that I actually work with to help this. And like I said, this is something that, you know, we've been able to narrow down and work out the problems and identify where, you know, we see that people tend to approach this from a little bit more of a sloppy approach. They just give testosterone to everybody. There's not a lot of adoption of, you know, making the adaptations that are necessary to get you to optimal. And that's critical, is not just to get your initial levels, but to get you started on something and then follow up and see how you're doing. And we do find a lot of men, they'll come in from other clinics and where they've been working on their hormone levels, and yet even though the testosterone levels are looking good, they still don't feel like they're getting the benefits. And that's where you want a team that's used to looking at the deeper aspects of this and understanding what we call the physiology or hormone metabolism is going to be really incredible there. So hope that helps. Reach out if you need some help. Stay tuned for future videos. We'll talk to you soon.